Chiropractics, your Houston chiropractor, Dr. Gregory Johnson, and we have Shari here with us this afternoon. And they came all the way over here from Hope, Arkansas, right?
Ashtown, Arkansas.
Ashtown, Arkansas. Yeah, so I knew somewhere close to Hope,
Yes.
though, right? Texarkana. Yeah, and you came here for primarily hiatal hernia, correct?
Yes, sir. Yes, sir.
And so you've been suffering with that for how long now?
For about 4 or 5 years now.
4 or 5 years.
Yes,
And
sir.
you've been through all the medical care, and has any of that helped you?
No, sir. At the end of my road.
Okay,
Been through
so
it
we're
all.
kind of last resort, huh?
Yes, sir.
Okay, so this will be Shari's 4th adjustment. She on the full week plan. For people that come in from out of town, we take care of them twice a day, Monday through Thursday. So this will be her 2nd treatment today on Tuesday. So let's take a look here. We're going to check her posture first. So let's have you flex your head forward and then backwards for me, Shari. And then neutral. Take a deep breath in and relax. And we check her posture just like we do every patient's posture, because biomechanics really is at the root cause of most people's acid reflux or hiatal hernia. So when we correct the thoracic spine vertebral misalignments with the rib cage misalignments in the back and in the front where they attach to the sternum, then the diaphragm becomes stronger and can hold the stomach down below in the lower cavity where it's supposed to, and not secrete acid up into the esophagus, which is what acid reflux or hiatal hernia is. So we're not really treating her hiatal hernia, we're treating what's causing her to have a hiatal hernia. So let's go ahead and have you come over here on your tummy first, Shari. And I'll have you put your face right down in there. So her legs are exactly even now. When we started, her right leg was short by a half an inch. Now it's exactly even, but that tightens up still a little in your low back right there, huh?
Yes, it does.
Yep. So she's got still a positive knotless, but there's no Deerfield there because she didn't have a short appendage. So we're going to adjust her SI joints first. That's the left one. And the right one. You notice I'm doing the adjustment at a 45-degree angle through the alignment of the sacroiliac joint where it meets the sacrum, which is this middle triangular shaped bone right here. There we go. And then I'm going to adjust L5, straight P to A in the Z axis, L4, L3, and you notice the angle of my arms are changing as I adjust all the way up her spine, because this is the way the joints lie. And then when the table drops, it gives me an accelerated shear force, and that is the physics of biology. Object in motion tends to remain in motion. So when I adjust the spine with a high velocity, low amplitude thrust like that right there, the vertebrae keep going in that range of motion even though the table stops when it drops. Now the legs are even. I bet you this feels easier this time though.
Yes, it is.
Good. She adjusted really good during the thoracolumbar area today, which is right where her lower rib cage attaches. We don't pull the turbinator out on her. We're just going to use the Genie rub. Gives a percussive type massage into the tissues, increasing the blood flow into these tissues, which helps them heal quicker, brings in more oxygen, nutrition, and it also helps expel more carbon dioxide, histamines, prostaglandins, substance P, all the toxic metabolic chemicals of metabolism of the muscles. And we work on our paraspinal muscles all the way up down through here. Those are still a little sore, aren't they?
They are.
Now she's had some lung problems here through the years as well that's gotten progressively worse, so you can see she's really sore up in this T1 through T4 area. And that's the sympathetic nerve supply to the heart and the lungs. So we pay special attention to this T1 through T4 area on her, because this is a sympathetic nervous system, supply our autonomic nervous system to the heart and the lungs. Also the thyroid gland and autoimmune system. So there was T1. T2 on that one. Good. Okay, let's turn you on your back now. Caught. There we go. There. Okay, now just lay your head right in my hands on this one, just like you're sleeping. Perfect. Good job. Same here. Boy, you're relaxing good and everything's moving good. Okay, so we're going to adjust her from her ankles all the way up into her low back there. Same thing over here. Now I'm going to pull her down on the table so we get her shoulders and ribs over the drop piece. So let's put your arms out like this and flat. We're going to adjust her AC joints in her shoulders. Here, the costoclavicular joint right here on the right side or left side, and then this one on the right side right there. And then we're adjusting the costosternal ribs, where the ribs attach to the sternum in the front, bilaterally on both sides. And then, there we go. We check her rib cage, and she is a little bit lower on this right hand rib cage, and she still is about 1/4 of an inch. So we're going to adjust that rib cage up on this right side a little higher. There we go. And so now I'm going to pull her stomach down, so take a nice deep breath in and let it all the way out. Just keep letting it out and exhaling. Sometimes this stimulates the cough reflex on her, but you just keep pulling that stomach down. You notice I don't slide down on the skin or on the shirt. Deep breath again and exhale again. Make sure you get below the xiphoid process. By the way, you shouldn't do this unless you're a licensed healthcare professional or a spouse that I have personally taught this to. Robert has actually learned how to do this, so when they get home, he can continue pulling her stomach down through her diaphragm for her as she continues to get chiropractic adjustments in whatever city she wants to get her adjustments in when she goes back home. Very good. Excellent. We've also been working a little bit on her ileocecal valve over here, which is still a little tender right there, huh? And then also on the valve over here between the large intestine and the rectum gets a little stopped up occasionally too. And a lot of people that have constipation will notice that and feel that. So we do some colon massages and also work the muscles that are somatically related to the nerves that supply the colon. And usually a person will go to the restroom, I'll sit you up face towards your knee, within 8 hours of their first adjustment. There we go. Let's turn everything facing towards your knee. There we go. Okay. Now I'm going to adjust her shoulders, elbows, and wrists. Perfect. Yep. Good. Okay. There. Okay. Left elbow and wrist. Perfect. Shari, would you mind sharing with our YouTube subscribers and watchers your story and how you're feeling now after 4 visits of here?
I came with really bad problems with acid reflux. The past couple of days, even on the first day, there was a huge improvement. He didn't tell me to stop taking my medicine, but I didn't take it because I wanted to see if the results were really up and up, if it wasn't my medicine.
Well, and I also told you to eat anything and everything you wanted to, right?
Yes, which I did for the past couple of days. I've had no problems with acid reflux at all, none whatsoever. I also changed my my sleeping position, which I was sleeping upright.
Which is the way most medical doctors
Which
tell
is
you
what
to
I was
sleep
told.
at 45.
Yes, sir.
Yeah.
Now I'm actually propping my legs up and laying flat
And laying
down.
all the way flat back
Yes.
with no pillow under your
With
head.
no pillow.
And
it
you're
is
able to do that without problem, right?
no problem at all.
Yep.
No problem.
So a lot of you acid reflux sufferers and hiatal hernia sufferers, that's a old wives' tale about having to prop yourself up at a 45-degree angle. In fact, it's better if you lay all the way back on your back, prop your legs up at an angle here where the lower legs are parallel with the floor, and your head all the way back, so it opens up your airway and does not pull your stomach up through the diaphragm. When you're up like this, it actually pulls your stomach up through the diaphragm even more. So I don't really know where that got started, but it's not something you should be doing. And is it worth the trip to you?
Yes, sir.
To come over here?
Yes.
Well,
yes.
thank you for sharing your story with us,
Oh,
Sherry.
you're welcome.
And Donald, thank you for coming over too.
Robert.
Excuse me, I don't know why I keep calling Donald. Okay, so this is your Houston chiropractor. We'll see you next time.